we're all just very excited at Renaissance. This is an area of need that we've been talking about for years. Renaissance has been a school in Indiana for 22 years. We started in 1987, and since its inception, our students have struggled with family issues, life issues, school issues, etc. And we can deal with those pretty well. But the health issues were always something that we just felt that we didn't have the resources to address. You know, it's easy to get a kid a book if they need one. It's easy to get them a lunch if they need one. But when a student's in pain, when a student's not feeling well, it's hard for them to focus on their work. And having it at the school and having such a fine facility with the caring people that we've come to know from community is just wonderful. It's a dream come true for all of us who've worked there for so long. We've also tried to build a relationship with our neighbors in and around the school, and having someplace where they can go and get to know us, get to know the school, access care that they wouldn't otherwise be able to get. That's just wonderful. It's empowering for us all. It's not just the students who get sick. It's the whole family. It's mom, it's dad, it's grandma, it's grandpa. Many of my students have long-term, ongoing health issues, and what we find out is that sometimes the consistency of care is not there, not because they don't want it, not because they don't need it, but because it's just not easy, and it's not convenient, and it takes a Herculean effort on the part of the parents and the students just to make an appointment and to get in to see a doctor, and so often, unfortunately, they don't. This is going to be right there with them. So these students with ongoing health needs, diabetes, asthma, any number of issues. We have students who have sleep apnea. They have ongoing counseling, therapeutic, or mental health issues. Those students are going to, they're not going to have to take any extra steps to get where they need to be. The families are going to be able to come in, and they're going to be able to bring in their younger brother or sister or grandma who needs to access health care. The overall health of the community is going to improve because they're going to get used to it. They're going to have access to things that they never knew were even out there, and that's just going to mean huge successes. And frankly, I guess I'm being a little selfish. I want more students to graduate, and if they're healthy, if they're comfortable, if they're being served, then they're more likely to graduate and get on with life and enjoy the benefits of an education. There are other doctors, there are other clinics perhaps in and around Indianapolis, but none in this particular area. There's a vacuum here. The people who live in and around my school don't have a neighborhood doctor, a doctor they can just go to. All of those doctors have left over the years for whatever reason, and there's just this vast emptiness. And so having this is frankly a beacon for everybody to rally around. Having it in the community, having Community Hospital and Warren Township Schools and Renaissance bring this together for the greater community, I think speaks of our commitment to the community. It's not just one thing that it's going to impact. It's not just one group that it's going to impact. Old, young, white, black, brown, it doesn't matter. We're all going to benefit from it.